Hello, everyone. Once again, it's my pleasure to join you in this discussion, which is about extending social security, social protection, social welfare to people who are in situations of vulnerability, including people living with HIV. I will I'll share my screen and make a short presentation presenting some of the examples and some of the work that's happening on this issue. So my starting point here is, if you want to end AIDS, it won't end just by providing treatment and and taking care of those who are still not in the reach of HIV testing, etc. We need to provide systems that provide holistic support to people living with HIV. Because when you are on treatment, you need good nutrition, you need income, you need basic support to keep yourself and your family moving. And therefore, treatment alone is not sufficient. However, it's an extremely important input for everyone. Whenever there's an infection or a disease, we do need treatment, but we do need other services as well. Now, the point is, so why does it matter to talk about HIV sensitive social protection, which basically means integrating HIV in existing social protection policies and programs, so that we talk about more sustainable options, not an ad hoc kind of an arrangement. And this is needed because HIV and poverty are one closely linked and they reinforce each other. And as you see, the social protection schemes and social security schemes are essentially aimed at taking care of those who are poor so that they have a safety net to fall back on and to live their life with dignity. We have seen that social protection reduces economic vulnerability and improves health outcomes for people living with HIV as well as their families. So we did a study in the ILO a few years back where we tried to look at the access and effects of social protection on workers living with HIV, and we found that those workers who had access to social protection, in their case, treatment was working very well, and they were able to take care of their families very well. Children were in school, so overall quality of life was much better, and they felt much more on course of a good life. So that is where we saw that it just improves health outcome, but also outcomes in terms of dignity, in terms of economic status, in terms of educational status in the family. Therefore, it supports HIV prevention and treatment. And HIV sensitive social protection helps not just people who are at the risk of HIV, but also those who are affected so that they live their life properly. From the ILO, we have two main instruments. For HIV, we have the instrument called HIV Recommendation 200, and it talks about uh, measures to address HIV and AIDS in the world of work should not should be part of the national development policies and programs, including those related to labor, education, social protection, and health. So we do see the link between health policies and development policies and social protection, because they all three need to come together if we want to have proper programs. For social protection, ILO has a recommendation called Social Protection Floor Recommendation 202, which talks about universality of access, non-discrimination, and gender equality. So it recommends strongly that member states need to keep these considerations in mind. So what are the core elements of HIV sensitive social protection in this discussion? Number one, at the policy level, the idea is to integrate HIV into national social protection policies and programs. So there may be a social health insurance policy, there may be an unemployment benefit policy, there may be a labor department policy meant for workers, and we need to see to what extent it includes HIV. If not, sometimes it's a very small intervention that is needed to look at the conditionalities which are part of the policy. Once you remove those conditionalities, people start accessing those services. Then we also have social safety nets programs, like we have seen the cash transfers being done to poor families. If they also include people living with HIV and their families, it helps a lot. Keeping children in school reduces vulnerability of young girls to HIV. It has been demonstrated in several countries. So there are cash transfers, vouchers, food support, and school assistance. Those social safety net programs need to be reviewed and seen from the angle of HIV, and see to what extent they are covering households of HIV. If not, we should try to do advocacy for enhanced coverage. If we also see there are health and social services such as health insurance, nutritional programs, and psychosocial support programs, which should also be extended to cover people living with HIV. And there are programs for livelihood and economic empowerment, uh, whereby we go to people, strengthen their skills for business, setting up their enterprises, enhancing their employability, providing them bank loans, microfinance to help them set up their businesses and enhance their economic status. Those programs should also include HIV. And finally, and not but not the least, is there are programs on human rights protection and social inclusion. Uh, they should look at HIV, because sometimes, because of stigma and discrimination, people living with an HIV do not have access to those programs. So we need to make sure that the programs which are meant for inclusion do not exclude this important group of people living with HIV, which, by the way, globally is 41 million, as we know. Now, there are some good examples which are already happening of integrating HIV in existing programs. For example, in Cambodia, um, they have included people living with HIV in their poverty, national poverty identification program, under which they register people and then they give them a card. Once that card is called equity card is given, they start accessing cash transfers and food assistance, a lot of health benefits, insurance, as well as education support for families. This has shown a very positive impact on the lives of people living with HIV. India has made great strides in integrating people living with HIV in government schemes, and which are meant for welfare, which are meant for um, support to poor families, to vulnerable populations, and they include access to pensions, food assistance, educational assistance, and livelihood programs. And they're also, when this was happening, we looked at the conditionality, and sometimes we found that, for example, in a pension program, there was a government scheme called Widow Pension Scheme in India, but there the eligibility was 35 years of age, and we realized that average age at which women living with HIV or women of HIV affected households were getting widowed was much lower. Average age was 29 years. So we used that study and made a case with the government that why do you have this education with this kind of age-related conditionality in a widow pension program? So they removed it because they thought it doesn't make sense. And so women living with HIV who got widowed, um, or women whose husbands had died of HIV, they started accessing the pension. Similarly, there are programs of Labor Department, Labor Welfare Department, who have number of very good schemes for different types of workers, for constructions workers, for mining workers, for workers who are kind of peculiar health workers, etc. And we need to do mapping of those schemes and inform people living with HIV about those schemes so that they start registering them in them. For example, this scheme from Gujarat, excuse me, we got a construction worker who was living with HIV, part of this scheme, who got a card made from Labor Welfare Department, and as a result of that, he could access the loan at a very concessional rate and build his own house, to have a good house for himself. There are other examples coming from Kenya where cash transfers for orphans and vulnerable children is happening. In Thailand, there's health insurance access for migrant workers, which has been extended to HIV. In Uruguay and Brazil, there are programs meant to extend social insurance to low income and self-employed workers, as you see. So this is also happening. So there are schemes at the government level which do provide a lot of very useful support to people who are poor, or people who are vulnerable, who are disadvantaged or marginalized. Now we need to see that how could we make sure that those schemes start get into the households of people living with HIV. And with these examples, it's clear that it's possible to do so. Now, the global AIDS strategy that we have, uh, very ambitious targets are there, but targets are not just linked to treatment and testing and prevention, but there are also targets which are talking about people-centered and rights-based approaches. Uh, and one most important point here is reduce inequalities, because there are inequalities that are driving HIV vulnerability, and inequalities are related to economic status, related to stigma, related to exclusion, and we need to find ways of being more inclusive in our responses. And therefore, the Global AIDS strategy is strongly recommending that we integrate HIV into not just health, but social welfare and community systems. We are also talking about employer-based support programs within the ILO that extend to workers, and we need to make sure that the employer's insurance also covers HIV, or they at least try their best to ensure that workers are not really devoid of support from the employer. And the most important support from the employer can be right to work. People should not lose their jobs because of HIV, because if they lose their job, they will die much faster than they would have died with HIV, because work is very important for all of us. So we are talking about strengthening sustainable, nationally owned responses through these measures, and at the same time expanding protection and security for vulnerable populations, which are, by the way, not just people living with HIV. Under the SDGs, the idea is to identify which populations are being left behind and map them, where they are, where do they live, what are the reasons that stop them that from accessing government schemes and programs, and then try to address those reasons, those bottlenecks, and then support them and listen to them, bring them to the discussion table, so that programs become much more exclusive. So these are some of the examples I briefly attempted to mention, and I will conclude by saying that we are in a situation that uh, AIDS response is calling us to bring AIDS response out of isolation. It cannot be just driven as a medical department's program. So it got to move beyond the spheres of health, um, into the spheres of social support, into the spheres of social protection, into the sphere of employment support. And if that happens, the program will be much more sustainable. And at the end of the day, that would be the real people-centered approach. So I thank you, and I hope uh, this will lead to some discussions. And I wish I was there in person to take some questions, but I do hope that you will hear other panelists and you'll explore answers, but at least go back with some ideas which would help you in strengthening social protection, expanding social protection to people living with HIV and their families in your countries. Thank you very much.